Assalamu alaikum everyone, I'm Dr. Ahmed Al Khatib from Universal Hospital, and I'm very happy today to have a small talk with Dr. Hasnain Haider-Shah about the pain management. Dr. Hasnain is a consultant in interventional radiology, also consultant in neurointerventional, and he's also consultant in pain management itself. And we are lucky that he is also working in the hospital as a chief strategy officer. So we're very happy to have you with us today, doctor. And doctor, how can you define pain management?
So pain management is a relatively new specialty that involves taking care of patients' pain. And often it's acute pain that becomes chronic pain. So pain that the patients have had for a long time. And it can involve any parts of the body, headaches, neck aches, back aches being very common, of course, joints, shoulder pain, knee pain, these are all very common types of chronic pain. And what we do is we use the most advanced techniques and minimally invasive techniques to manage that pain. And that involves more than just giving medications, but it involves actually taking care of the root source of the pain.
I have, from my experience working in the emergency department at Universal Hospital, I get so many patients complaining of backache, stomachache, headache, knee pain, previous injuries, all of them kind of chronic pain. Chronic means pain for a long time. So these patients, they come frequently to the hospital asking sometimes about strong medication, and you give them a medication, they'll ask for a stronger one, and then they get dependent on these medication and there is no solution for them. So doctor, what do we have in our hospital that is so special in the regard of managing these patients? And do we have a scale to go by?
Sure. So what we use is the WHO pain ladder. And the pain ladder goes step by step. You start with what we call the conservative treatments. So conservative treatments involves pain medication, involves physiotherapy, massage, heat, cold, different things that are minimally invasive and conservative. Then beyond that you move to the next step. So the next stages are you do pain blocks, you do injections, you do more advanced invasive therapies. If that doesn't work, then you move to the higher invasive therapies, which include, for example, radiofrequency ablation. We can do joint injections with PRP, which is platelet-rich plasma. We can do injections with ozone. And if those don't work, then we move to the next step, RF ablations, cryoablations, different ways of ablating the nerve to eliminate the pain. And then the last step, we start to go into what we call spinal cord stimulators and intrathecal pain pumps, which are actually direct injection of medication into the spinal area.
Doctor, you mentioned some really important and nice terms that people may do not understand. You mentioned, for example, ozone therapy. You mentioned minimal invasive discectomies, and you mentioned PRPs, spinal cord stimulator, medication pumps. So can you please elaborate on that and explain to people what exactly is the benefit for these things?
Sure. So these minimally invasive therapies are, as you correctly pointed out, are not available at other hospitals because there are advanced therapies, and you need advanced training to administer these therapies. For example, ozone. So ozone is a gas which is basically oxygen molecule. Oxygen molecule usually occurs as O2. Ozone is the O3 component, so it's 3 oxygen molecules together. It works as an anti-inflammatory, works as an anti-pain medication. It has many antibacterial properties, anti-inflammatory properties, and what we can do is we can inject it in different places. We can inject it into joints, we can inject it directly into a disc, we can inject it directly into a ligament and actually relieve patient's pain. The other thing that we do also is something called PRP, platelet-rich plasma. So you take patient's own blood, and within their own blood there are many growth factors and other factors which help promote healing. That's correct. And anti-inflammatory effects also. And in fact, many of the most famous athletes now, Rafael Nadal or Tiger Woods or some of the other big sports and cricket stars, use these therapies first before going for more advanced treatments. And what you do is you take the patient's blood, isolate a certain part of the plasma by centrifuging it, and you get that growth factors, and then you can inject those into areas that are injured. You can inject it into a disc, you can inject it into a ligament, you can inject it into a joint, and all of those start to repair, and repair at a much faster rate than if that had not been injected. The other thing we do is peripheral nerve and spinal cord stimulators. So we use the gate theory of pain. The gate theory states that pain travels along nerve pathways, and if you stimulate those nerve pathways, then pain cannot travel along and pain gets blocked.
Because the place is filled.
That's right. So basically, Yeah, so we use the train analogy. A train fills up the pain, basically the stimulator fills up the nerves with other signals, what we call a vibratory signal or other type of signal, and then pain cannot travel along those nerve pathways.
So if I want to use a simpler word to describe it to people, basically your spinal cord is the door of the pain.
That's right.
It's the door to the pain, or the door to the sensory receptors all over the body.
That's right.
So if you block this door with someone, if I get a very big guy and make him stand at the door, which is in here,
what the spinal cord stimulator does, exactly.
This guy will block the door as a bouncer. Nobody can go in or can go out because he is blocking the door.
That's right. So pain is stopped at that level where it's occurring. So you can do this in the spinal cord where the nerve pathways travel, or you can even do it for patients who have trigeminal neuralgia or atypical facial pain, where you can even put the nerve stimulators near the cranial nerves or in the face actually. And these block that pain receptor and the pain signal.
Localized as well.
That's right.
Oh, that's really nice.
That's right.
Okay. Doctor, what about the follow-up? And let's say the rate of recovery for this patient, and how much do they get better after you do these procedures? I mean, I personally have seen lots of patients that come to the ER complaining of chronic pain, and once they send them to you, they never come back again.
Right.
So either they ran away or you treated them. So what happens?
Yeah, so usually we can actually find out, and kind of what we do is we use CTs, MRIs, nerve conduction tests, EMGs to localize the pain source, and we treat the pain source specifically. So let's say, I'll give you an example, as a disc, a person who has disc pain, the disc pushes on the nerve and they get pain symptoms usually going down the legs and in the back. What we can do for those patients, we can do what's called a mini discectomy or needle discectomy. So prior, people used to do surgery and remove the disc. What we can do is actually with the needle, we inject the disc with the needle, and we can actually remove pieces of the disc through the needle. And at the same time, we inject a chemical into the disc, usually something called discogel or ozone. At the same time, it shrinks the disc. So what you've done is you've now treated the disc problem, which was causing nerve compression, all through a simple needle. And the patient can go back to their regular work schedule within 24 hours or 48 hours, and they can go back to their normal activities within a week.
So basically you save the patient from the pain or the struggle of having a spinal surgery.
That's correct.
Which is by itself scary for any patient. When you tell them that you're going to have a spinal surgery, he's going to say, oh, maybe I'll be paralyzed, or maybe I don't want to have the spinal surgery, and he's going to keep on taking this controlled medication, as we call it over here, and he's going to get dependent. So you save them all this trouble with a simple procedure.
That's right.
That doesn't require even general anesthesia.
That's right. And this is the new paradigm for treating patients. Is in all surgeries now, in all procedures, we use minimally invasive. We try to invade the body or cause at least little damage to the body, at the same time providing healing mechanisms. So what we're going to do is use the body's own healing mechanism. So for example, PRP, we're using the body's own blood to heal the body. And what you can do is, we know that we can save patients from shoulder surgery or knee surgery by having these procedures done. If you have a small meniscal tear or you have a small ligamentous injury, by injecting this PRP plus ozone, you will actually heal that injury without the patient having to go to surgery.
So doctor, one more question. If we want to give the audience a take-home message, what would that be?
So I would say the take-home message is that pain management is a new specialty, and we use minimally invasive methods to control pain, and we try to get you off some of the controlled medications or the high-dose medications which can either damage your liver or damage your kidney. And what we can do is we can treat your pain very minimally invasive and provide something that will give you pain relief in the future. To summarize the discussion that we have today, pain is a really serious and important symptom. The old ways of treating pain are not that effective because it is causing dependency on controlled medication, and it is causing the patient to visit the ER or the hospital frequently without any relief of his pain. Now, what we have at Universal Hospital is a new way of treating pain. We treat the cause and not the symptom. And this way we do it with a minimally invasive techniques. That means the patient does not have to go through any kind of surgery or a spinal surgery or some kind of difficult procedures. He will have some simple injections, some simple introduction of medication to the source of pain. So thank you, doctor, very much for this small talk that we had with you. I'm really glad that we had it with you. And I just like to thank everyone who watched this video. I hope you guys benefited from it. Thank you one more time.